All right. Welcome to All Things Odd. I'm Dr. Natalie Phillips.
And I'm Dr. Hannah Galloway.
All right. And so today we are going to kick off May with Better Hearing and Speech Month. So I'm going to let Dr. Galloway talk a little bit about what Better Hearing and Speech Month is.
Yes, so fun fact, Better Speech and Hearing Month was founded in 1927 by ASHA, which is one of our professionals' governing bodies. It's audiology and speech combined. We also have specific audiology groups like the American Academy of Audiology. ASHA was kind of the first one, so it's the American Speech and Hearing Association. And so anyway, they took the opportunity to name May Better Speech and Hearing Month in order to give the opportunity to kind of educate people about hearing loss and just, provide awareness to the community about better speech and hearing. And so actually last year, we got the city of Fort Collins to give a proclamation declaring May Better Speech and Hearing Month in the city of Fort Collins. So that's pretty cool. We have it framed and hanging in our office if you come in. So that's kind of why we're talking about Better Speech and Hearing Month today. So we have some facts about hearing loss and things that are audiology related that we're going to kind of go through and talk about.
Awesome. Yeah. So as we go through our facts, if you are an audiologist, come join in the conversation and kind of share your thoughts about the fact. Or if you're watching this and you want to share it out to your friends so that they're a little bit more aware of ears and hearing loss. I think it's kind of interesting, although we're audiology nerds. And so we always think it's interesting. But we are here live on Facebook, but then also live on YouTube and then also in LinkedIn. So go ahead and share one way or the other because this is May. So we're going to spread the awareness. All right. So we'll go over this first fact. About every 2 to 3 out of every 1,000 children in the U.S. are born with a hearing loss in one or both ears. So Dr. Galloway is going to talk about that in a little bit.
Yeah, so we find that a lot of adults are surprised that so many children have hearing loss or wear hearing aids. I usually get the commentary whenever I'm getting out our little color swatches of all the different colors we have in hearing aids. And there's bright pink and bright purple. And don't even try. You can't get those unless you're a kid. But people are like, oh, children wear hearing aids? And so, yeah, 2 to 3 out of every 1,000 are born with hearing loss in one or both ears. We know that because we do newborn hearing screenings on every baby before they leave the hospital. So that's new in like the 1990s. But yeah, there are more kids than you would think that have hearing loss. And the next fact kind of goes along with it. It's more than 90% of deaf children are born to hearing parents. And that's because of the way that the hearing loss genes are passed down. And so, the majority of children that are born deaf in the United States right now, their parents have hearing. And so cochlear implants, I think, have become a lot more popular because of that. Because when, you've only known hearing your whole life, of course, you're going to pick that for your child. So yeah, actually 90% of deaf children are born to hearing parents.
Awesome. We have to pause to say hello to our friend, Dr. Gozalia out on the West Coast. And he says, yay, happy Better Hearing Month. So he has been really, really great at really getting the word out, whether he is on Fox LA, if you guys are watching. I think he had something that he was working on this morning as well. And just he and his partner, Jane, have been really good about getting out this message. The best coast, he says, #best coast.
Well, and he is part of the reason why we decided to try to get the proclamation in the city of Fort Collins. It was kind of a group effort to see, if all these different practices across the United States can get their cities, aware of this. That's huge. So yeah, thank you, Dr. Gozalia.
Yeah, and he started this out in California on the best coast, and he got a bunch of audiologists to go together actually and do it as a group. So it was kind of fun to see that. So West Valley Hearing, I believe, Dr. Gozalia, please put your link to your business in the comments as well. And thank you for showing up on our show today. All right. So, again, going over facts just to celebrate Better Hearing Month. Age is the strongest predictor of hearing loss among adults and the greatest amount of hearing loss within that 60 to 69 age group. What's interesting is with this particular topic about age, a lot of people ask about, when is it best to get my hearing tested, right? Or what I like to share is the average age that we fit on hearing aids are kind of like between the ages of 40 to 60 years of age, really, because those are people that are still in the workforce and they're noticing that, while they're working, they're having difficulties hearing in conversations. And so, again, even though, the hearing loss is mostly in that 60 to 69, the highest, I should say, percentage, we still have people from age 0 all the way up to, you can imagine, right, with hearing loss that we're finding. So, age is definitely the strongest predictor. However, we are fitting people much younger as well.
Okay, Natalie, so what is the youngest and the oldest patient that you have fit with hearing aids?
Okay, so the youngest that I have ever fit is 5 weeks old. So it's
Wow.
crazy. Yeah, I used to live in Texas, and I worked for the Sounds of Texas project. So we were on top of the screening twice, right? So once in the hospital and once right before they leave, and then that diagnostic on that third try. And then we had access at the Callier Center in Dallas to be able to do, at the time, this is crazy, ASSR wasn't really out there back in the day. So we literally had to do multiple tone bursts for getting frequency responses, one at a time. And then we repeat it. So
With
I'd like do
ABR?
it. Yes, with an ABR and then bone conduction too. So I'd have to take that 2-finger method and hold the bone oscillator while somebody got the ABR. And so it was tedious, but what was interesting was we were able to repeat it and then also get hearing aids on a 5-week-old baby. And
Wow.
then I think the oldest, oh my gosh, I don't even know. I want to say maybe in the 90s, but I'm not really too sure. But I would have to say, yeah, maybe 90-year-old. What about you?
I fit somebody that was 99 in the last year. So that was one that's memorable. That's probably the oldest patient that I fit. Youngest, I think, is probably about 2. I've had quite a few toddler hearing aid patients. And so hearing care for babies is especially hearing aid care for babies is really specialized because as your ear grows, the sound is different in the ear. And so the loudness level is dependent on the size of the cavity that the sound is put into. So with babies, they're constantly growing. They constantly need new ear molds, and then you constantly have to be kind of refitting. So we don't see a ton of infants, although we could. But yeah, a lot of times children, go to children's hospital kind of for that initial diagnosis. They might have to have like a genetic workup done. And then, Children's Hospital also has more specialized equipment like the ASSR, which isn't in a lot of other offices. So a lot of times babies will go there initially, and then they can, kind of come find a hearing aid provider. We have several kids that are patients, but yeah, I think 2 is the youngest and 99 is the oldest.
Wow, that's so cool. So as an audiologist, if you're watching this, that's a great question, Dr. Galloway. So put in the comments too, what's the youngest you've ever fit with a hearing aid and what's the oldest, and we'll get the conversations rolling. Maybe we'll have like a competition. So,
Yeah.
audiologists, we're so type A. We're just like, oh, we want to compete
Well,
all the
I've
time.
joked multiple times that I think audiology is unique in that I could have a patient on my schedule that's 3 months old or 100 years and 3 months old. And that actually happened one time where I thought my patient was 100, a little over 100, between 100 and 101, and they were actually 5 months old. And so it was only the last 2 digits of the birth year on my schedule. So I was expecting a very elderly patient and it was a very young baby. So it's kind of funny because I think that audiology is unique that way, that we can kind of see all ages.
Yeah, that's kind of fun too. Which goes to our next fact that 1 in 8 people in the US, about 13% or 30 million, age 12 years or older, has a hearing loss in both ears. And so, again, looking at the age factor, right, it's kind of crazy to think that it is so low, the 12-year range. Like a lot of people don't necessarily think about that there's actually, at age about 12 years and older, you're already in that 1 in 8 right,
Yeah.
population of having a hearing loss for both ears. So again, going
Mhm.
back to that age factor. Yep.
Well, and again, I'm going to go kind of back to the age when we were talking about age is the
Mhm.
strongest predictor. I always love to give patients research that they don't probably want. But in grad school, we talked about this study that was done on indigenous basket weaving communities. So people that had never been exposed to industrial noise in their lifetime, not a firework, not anything like that. And they didn't start to get hearing loss until after age 60. And so I tell patients, it's not that you can't get hearing loss before that. That's
Mhm.
just if you've had no noise exposure. All of us Americans have had, fireworks shows, concerts, things like that that are noisy. So a lot of people are getting hearing loss before age 60.
Mhm.
But usually patients will ask, like, well, do you think this is just because of age? If you're 55, probably not. So, anyway, I thought that was really interesting because that's a unique population that, that we could do that study on.
Yeah. Oh, interesting. All right. So, which goes to, talking about noise, this is kind of an
Mhm.
interesting fact about tinnitus, right? So, approximately 10% of the US population, which is 25 million Americans, have tinnitus lasting at least 5 minutes, which I thought that was kind of funny to
I did
measure.
too.
I was like, what? 5 minutes, lasting 5 minutes long. But really, we added this part into that 50 million people actually have tinnitus, and 1 out of every 100 adults report that it's debilitating, which means that maybe they're constantly noticing it throughout the day, or it can affect your sleep patterns at night. Um, this, again, is close to my heart because I've been working with tinnitus patients for probably like 25 years now. And so it's super fun to be able to help these types of patients, and I feel like it's not getting any better, right? There's still lots of influx of people that are noticing tinnitus.
Mhm.
It's interesting to know that 10%, because I didn't know that part actually,
Right.
have tinnitus that lasts for 5 minutes, but really 50 million people. So double that are
Yeah.
starting to notice that they have tinnitus. And 1 out of 100 is actually a lot where they're
Mhm.
noticing that it's more debilitating. I know that COVID, we saw a spike, for various reasons. It could be because a lot of people were more in the quiet areas, right?
Mhm.
I think that stress levels, noise exposure, there's a lot of things
Mhm.
that are contributing to people noticing a little bit more tinnitus lately than not.
Yeah.
So that was kind of interesting as well.
And we've had several patients report to us that after having COVID, their tinnitus was more noticeable to them. And,
Mhm.
it's hard to know. There's a lot of different factors surrounding that. But since COVID is a viral illness, we have done on our previous episodes talking about research, it was found in the middle ear and the inner ear. So, it's stranger things have happened, right? But we've kind of kept a little log of that because we've had patients coming in and saying, after I had COVID, it got worse, or it started after COVID, or something like that.
Mhm. Yep. Okay, this one always shocks me. So this fact here really talks about who can benefit from hearing aids, and then who actually goes out and tries hearing aids. So shout out to all of our colleagues, our audiologists, that really are, on the front lines of trying to get people back to better communication and back to life, right? And
Mhm.
so this is really, really interesting. So among adults aged 70 and up, like with hearing loss, who could benefit from hearing aids, fewer than 1 in 3 or 30% have actually used it. So 30% if you're age 70 and higher. And then even fewer, so ages 20 to 69, only 16% that can benefit
Mhm.
have actually used hearing aids. And that is huge. So again,
Mhm.
spread the word. This is why we're doing this. This is why it's so nice to have a month every year to kind of celebrate better hearing, but then also to really come back to the basics
Mhm.
of what are the statistics showing us, and what kind of message do we need to get out there? Because look at that, 16%
Yeah.
and 30% of people are actually going to get hearing aids and going to get help. Okay. And again, with some of our other colleagues that are out there working on more of the cognitive part of it, that's really important to know that only 16 to 30% of people are actually going to get hearing aids that actually benefit from them.
Yep. And there's a really well-known statistic that we don't have on this list, but there's an average of 7 years time between when somebody needs a hearing aid and when they get one. And I thought was really interesting. One of the last conferences I went to, I'm thinking it was Doug Beck that said this. So, Doug, if you're watching, you can probably clarify because he knows it off the top of his head. But somebody told me that if you take cost out of the situation, that it doesn't change anything. So they did a study. I think it was in the UK.
I was going to say Canada because I feel like
Okay.
Canada, offers hearing aids at no charge, right? Or something like that. But I
Yeah,
do
so they
remember that too.
offer, universal statewide, countrywide healthcare, and so
Hmm.
that if you need hearing aids, they'll be covered for you. But it's still 7 years that people wait. So I know that all of our patients are going to say the first thing, I can't afford that. I'm retired. I can't afford that. Even if cost is taken out of the
Yeah.
equation, people still don't do anything. So I think that educating is really important because what we know now is the sooner we get the hearing aids on, the better things go in the long run as far as that nerve function and everything like that. So
Yeah. I'm glad that you brought that up too, especially about that study that was done about cost, because that's what people think about first, right? It's like, oh, I can't afford it, or I don't have the insurance. But even in a country that provides it for them, those percentages aren't much different at all.
yeah, and you'll hear all different kinds of reasons from people. I had a patient come in recently, and she's had several pairs of hearing aids, hasn't been happy with them. They just couldn't, they couldn't get past the cost. But in that same appointment, I heard that it was the cost. Our clinic is too far from their house. They don't go to restaurants or any sort of environment that's busy, so they don't need them. I mean, I heard probably they probably gave me 10 reasons. And so that you know, it's really not those reasons. That's kind of what they're using to not move forward with it, which is kind of sad. But
Yeah.
I think that patient will be back actually. So
Yeah. Well, and think about it this way. If you're sharing this whole fact out, right? Dr. Galloway and I, we're an independently owned practice, but what we definitely, our why is really to get you connected back to your life and back to your loved ones. That's the whole reason why we have our own practice, right? And that we're so dedicated into really developing information and education, but then also really making it easy for you to share it out, right?
Mhm.
And so, if you think about that fact and just getting people more interested and educated about, whether it's this fact about people not getting into hearing aids, I look at the time during COVID. And with Dr. Galloway and I working, we had just as many people come in to get
Mhm.
help because it's the communication factor. It's that
Right.
connection, right? People weren't even going out to restaurants anymore. They weren't struggling and they were at home but people still wanted that connection and that communication. And
Mhm.
so again, it really, there are a lot of excuses and a lot of reasons why people might not necessarily go to get hearing aids, but pass on along the fact that it's really about the communication and the connection to get you connected back to whether it is blank, your spouse, your loved one, whoever,
Mhm.
back to life. Okay. And so that's definitely our why. We have it smack dab on our website because we want people to know that this is why we're here, is to really get you connected back to your loved ones. Okay. So,
Mhm.
all right. So that was kind of a fun fact. Now we're going to kind of shift gears to cochlear implants. So, as of December 2019, approximately 736,900 cochlear implants have been implanted worldwide. Um, that's a huge, huge, huge number, and
Yeah.
yay, because we know what cochlear implants can do for people. So, Dr. Galloway, did you want to talk about this one?
Yeah, and candidacy, I would not, I don't know what the number would be in those last few years, but I would think it would be a lot more because the candidacy has expanded. So even, when I was in grad school, things were different. We didn't have the hybrid cochlear implant yet. So when that came out, that sort of encompassed a whole new group of people. And just recently, in the last couple months, the FDA has cleared cochlear implants for single-sided deafness, which is a really big deal because before it used to be that if one ear was completely deaf and the other ear maybe had some mild or moderate hearing loss, you weren't a candidate for a cochlear implant because it had to be both ears that were performing at this lower level. So I'm really excited to hear about that. We haven't had anybody get implanted yet for single-sided deafness, but I'm definitely looking forward to seeing some of that research come out because that's a very difficult situation for somebody, especially when you're used to having 2 years with normal hearing, and then suddenly something changes, and now you've been, deafened on one side suddenly, and what can we do? So cochlear
Mhm.
implants are amazing. And babies can be implanted with cochlear implants as young as 9 months old, I believe. And even earlier, if there are sort of reasons, if we think the cochlea is going to ossify or something like that, I believe they can implant down to 6 months. So, a child that would have been deaf their entire life now has hearing at 6 months, 9 months, 12 months. So, pretty incredible.
Yeah, that is. That is. All right. And then the last fact that we have. So these are all, not only the only facts that are out there, but these are just ones we wanted to cover today. Just kicking off Better Hearing and Speech, well, Better Speech and Hearing Month. Audiologists call it Better Hearing Month as well. But, we're going to be really pushing that this month of May because there's going to be a lot of audiologists and our colleagues around the US just really talking about this and even maybe internationally too. So, all right. So the last one kind of turns a little bit more medical. And it says that 5 out of 6 children experience ear infections or what we call otitis media, which is behind the eardrum in that middle ear space by the
Mhm.
time that they are 3 years old. And so my daughter is now 14, but I do remember when she was first born, she had multiple ear infections. And I do remember that, I was counting them because if you have a certain amount by in a span of time, then it's really important to not just get antibiotics but to really talk to an ear, nose, and
Mhm.
throat physician to see if tubes, we call them tubes, or something can be uh, inserted in there to really let that fluid out, because it's super imperative that if there is that ear infection and you do have that mild to moderate type of hearing loss, that's when speech is involved, right? And understanding speech and recognizing speech and then also producing speech as well. So it's super important that you watch this carefully with your pediatrician or with a ear, nose, and throat physician and your audiologist as well to make
Mhm.
sure, because tubes aren't a bad thing. Tubes make sure that as soon as that fills up with fluid, it's going to drain right out, and you're
Mhm.
not going to have that issue of maybe some speech delay or maybe something else. And so I remember this very clearly because I was so gung ho. I was like waiting. She was like one ear infection away for
Mhm.
tubes. I was like, I have no problem with tubes. Like, we're waiting, we're waiting. And sometimes it's hard because you can't see an ear infection unless your child
Mhm.
is tugging at their ear or it's hot or, they have a fever or something like that. So sometimes it's unknown whether or
Mhm.
not they have an ear infection, right? And so this is super important. What about you as a new mom, Dr. Galloway?
So Ruby had two in the first year, and I'm almost positive that the criteria is three separate ear
Mhm.
infections in 6 months or four ear infections in 1 year. Then that's when ENTs are recommending to put tubes in the ears. Ruby had two ear infections the first year, but had I not been an audiologist, I would have thought that she had an ear infection like 100 times more than she did, because when she's teething, and she has four teeth right now. She's 15 months old and she's getting all the rest of the top ones at like the same time. So she's teething, her mouth hurts, she's putting her fingers in her mouth, and she keeps pulling at her ear on the right side. And luckily, I have a very fancy otoscope at home because we had an extra for the clinic. So that's kind of been my device at home to check, and luckily I can do that. But I would have drug her into urgent care several times thinking that she had an ear infection, because she was tugging, but it was just the teething. So
Mhm.
she didn't have to do tubes or anything like that. And I hope that now that she's 16 months, she's a little bit older. So hopefully it won't be, something that we face again. But yeah, I working in an ENT clinic, we saw so many parents that were like, please just do tubes because we're not sleeping.
Yeah, true, true. And I don't know if it's a blessing being in the medical field or as an audiologist, being
Mhm.
able to be hypersensitive to that type of thing, but then also to be able to use an otoscope to look in the ears. Or like I remember dragging in my daughter and running a timp or something like that to make
Mhm.
sure that the eardrum was back to normal and it was moving back and forth and things like that. But it's perk of the job, I'm just going to say, is that
Yep.
we get to be a little more vigilant about that, but we're just passing on the information as well, so
Mhm.
that you can get it checked out if you are noticing any symptoms. So yeah, so with that, great kickoff to May, and we're going to be kind of putting in some of the other facts into some of our posts as well. If you're thinking of a question, if you're thinking of something that you want to share as a fact, put it in the comments. We can always come back and take a look at that, and we can talk about it a little bit more. Or if there's something else that you want us to talk about, especially during this awareness piece during the month of May, then let us know either by giving us a comment, a like, or even sending us a direct message on one of these platforms. So with that, we will be back next week with a whole new episode of All Things Odd, and we're glad that you could tune in. And we'll see you later.
Bye.